Hi there, this is Dr. Lavraj Sundar at Sejok Homeo Clinic. I'm a chiropractor here, and today's topic will be on osteoarthritis. So I'll go over 6 major things. I'll talk about what it is, what are the causes of it, signs and symptoms, diagnosis, treatment, and then, of course, lastly is prevention. Okay, so osteoarthritis is basically degenerative joint disease, and if you can see on this model, it can affect any of the joints in the body. It can affect the pelvis, the hip bone, the back is commonly affected, even the little joints in the hands. And what it is basically the cartilage in between starts getting less and less over time. And what ends up happening is you get bone on bone rubbing, and this causes a lot of pain. So some of the causes are aging is one of them, unfortunately, but there is a healthy way to age and a not so healthy way to age. So if it's causing a lot of pain and trouble moving every day, then of course this is something to get checked out. Other underlying causes are overuse and strain. So sports injuries can cause accelerated osteoarthritis, underlying bone disorders such as rheumatoid or increase in growth hormone. And another big common one is increased in body weight. What happens is when you have a lot of fat cells, they cause a lot of inflammation. So a lot of stress on the joints occurs, and this can cause osteoarthritis as well. So if you go to a medical profession or a chiropractor or a medical doctor, they'll go through basically the signs and symptoms, an x-ray, and a bone density scan, because decrease in calcium is also another factor. And some of their signs and symptoms are stiffness in the mornings. A lot of people, they wake up and they have all these aches and pains everywhere, so that's a common symptom of osteoarthritis. Secondly is clicking and cracking sounds with pain, especially in the knee and shoulders. That happens quite frequently. Inflammation of the joint itself. There's usually redness or swelling in the joint. And then you get pain more with activity. So the more you move throughout the day, you get more pain. So those are common signs and symptoms of arthritis. So x-ray is good for this. It shows if there's any bone-on-bone rubbing, get bony spurs sometimes happening. And then say if you are diagnosed with this, so some of the treatment options for you available are, main ones are of course physiotherapy. Chiropractic is a great one because we specialize in the joints and the bones of the body. You can get massage, you can get acupuncture. You can also, if it gets really bad, you might have to get prescribed medication to stop the inflammation and the pain management. And then actually, since we are a Sejok clinic, I'll go over a Sejok therapy. So basically, if you can zoom into this is a pressure ring. And basically what it is this is just an example. So say you have knee arthritis. If you put it in, this is a ring, so you just kind of put it onto your finger. And basically, so it looks like that. And then you're gonna go like this a few times. And this is supposed to help relieve the knee arthritis. So this is just one of the many treatments that we offer here. So this is part of it. And that's how you do that. So if you have any more questions or concerns, you're more than welcome to contact our clinic. And lastly, of course, is basically the prevention of osteoarthritis. Main things, like I said before. Number one is lifestyle changes. So controlling your diet, eating less inflammatory foods is a big one. Exercise. So just getting the joints moving is great for just anything, but arthritis specifically. Stretching and strengthening, proper stress management, proper sleep, and of course getting, if you need medications, proper dosage of that. And so that's, and reducing weight, that was the last one. So even losing about maybe 2 to 5 pounds can have a lot of relief on your joints. So that's those are the main prevention strategies that you can use at home. So that concludes our topic for this week. If you have any more questions or concerns, you can contact Sejok Homeo Clinic and we'll be gladly to help you. So that concludes our topic for this week. Thanks.